Question 1. A 42-year-old female client is admitted to the endocrine unit with progressive weakness, chronic fatigue, unintentional weight loss, and hyperpigmentation of the oral mucosa and knuckles. Laboratory findings reveal sodium 128 milliequivalent/L, potassium 5.9 milliequivalent/L, glucose 64 milligrams per deciliter, and cortisol levels significantly below normal. During morning assessment, the nurse notes the client becomes dizzy when moving from a lying to standing position. Which nursing intervention is the priority? A. Restrict oral fluids to prevent worsening hyponatremia. B. Place the client on a low-sodium, low-potassium diet. C. Monitor blood pressure closely and institute fall precautions. D. Encourage ambulation to improve adrenal gland stimulation. Answer. C. Monitor blood pressure closely and institute fall precautions. Rationale. The client demonstrates classic manifestations of Addison's disease with hypotension and orthostatic instability caused by aldosterone deficiency and volume depletion. Safety and prevention of injury from hypotension are the immediate priorities. Question 2. A nurse is caring for a client diagnosed with Cushing's syndrome secondary to prolonged corticosteroid therapy. Which assessment finding would the nurse expect to identify during the physical examination? A. Bronze skin discoloration and severe dehydration. B. Truncal obesity, thin extremities, and purple abdominal striae. C. Weight loss, muscle wasting, and salt craving. D. Hypotension accompanied by severe hypoglycemia. Answer. B. Truncal obesity, thin extremities, and purple abdominal striae. Rationale. Cushing's syndrome results from excess cortisol, causing fat redistribution, protein breakdown, skin fragility, and characteristic purple striae. Question 3. A client with Addison's disease develops severe vomiting, abdominal pain, confusion, and blood pressure of 78/40 mm Hg after discontinuing corticosteroids abruptly. Which prescription should the nurse implement first? A. Administer for hydrocortisone as prescribed. B. Encourage oral electrolyte replacement fluids. C. Obtain a 24-hour urine cortisol specimen. D. Place the client on fluid restriction. Answer. A. Administer for hydrocortisone as prescribed. Rationale. The client is experiencing an Addisonian crisis, a life-threatening emergency requiring immediate corticosteroid replacement to restore vascular stability and prevent shock. Question 4. A client with untreated Cushing syndrome is at highest risk for which complication related to excess cortisol levels? A. Severe hypoglycemia. B. Cardiovascular collapse from sodium loss. C. Opportunistic infection and poor wound healing. D. Hyperkalemia-induced dysrhythmias. Answer. C. Opportunistic infection and poor wound healing. Rationale. Excess cortisol suppresses immune function and delays tissue repair, placing the client at high risk for infection and impaired healing. Question 5. The nurse reviews laboratory findings for 2 endocrine clients. Which result is most consistent with Addison's disease? A. Sodium 150 milliequivalent/L and potassium 2.9 milliequivalent/L. B. Glucose 240 milligrams per deciliter and leukocytosis. C. Sodium 126 milliequivalent/L and potassium 5.8 milliequivalent/L. D. Elevated cortisol and elevated ACTH suppression. Answer. C. Sodium 126 milliequivalent/L and potassium 5.8 milliequivalent/L. Rationale. Addison's disease causes aldosterone deficiency, leading to sodium loss and potassium retention. Question 6. A nurse is educating a client newly diagnosed with Cushing's syndrome caused by chronic glucocorticoid use. Which statement by the client indicates a need for further teaching? A. I should avoid people with infections whenever possible. B. I may experience elevated blood glucose levels. C. I can stop my corticosteroids once I feel better. D. My skin may bruise more easily than before. Answer. C. I can stop my corticosteroids once I feel better. Rationale. Abrupt withdrawal of corticosteroids can precipitate acute adrenal insufficiency. Steroids must be tapered gradually. Question 7. A client with Addison's disease reports intense fatigue despite adequate sleep. Which physiological mechanism best explains this symptom? A. Increased cortisol production causing catabolism. B. Persistent hypoglycemia and decreased cellular energy availability. C. Excess aldosterone leading to fluid overload. D. Hyperinsulinemia from adrenal overstimulation. Answer. B. Persistent hypoglycemia and decreased cellular energy availability. Rationale. Cortisol deficiency impairs glucose regulation and energy metabolism, contributing to fatigue and weakness. Question 8. A client with Cushing syndrome is admitted with blood glucose of 320 milligrams per deciliter. Which pathophysiological process is responsible for this finding? A. Increased insulin sensitivity. B. Excess cortisol stimulating gluconeogenesis. C. Aldosterone deficiency causing metabolic acidosis. D. Decreased hepatic glucose production. Answer. B. Excess cortisol stimulating gluconeogenesis. Rationale. Cortisol increases glucose production and insulin resistance, leading to hyperglycemia. Question 9. The nurse is caring for a client with Addison's disease who suddenly develops severe hypotension, tachycardia, and confusion after surgery. Which action should the nurse perform first? A. Administer potassium supplements. B. Position the client flat and notify the rapid response team. C. Restrict sodium intake immediately. D. Encourage coughing and deep breathing exercises. Answer. B. Position the client flat and notify the rapid response team. Rationale. These findings suggest Addisonian crisis with circulatory collapse. Immediate hemodynamic support and emergency intervention are required. Question 10. A nurse compares assessment findings between clients diagnosed with Addison's disease and Cushing syndrome. Which finding is most characteristic of Cushing's syndrome rather than Addison's disease? A. Hyperpigmentation of skin folds. B. Weight loss with decreased appetite. C. Moon face and dorsocervical fat pad. D. Salt craving and orthostatic hypotension. Answer. C. Moon face and dorsocervical fat pad. Rationale. Fat redistribution causing moon face and buffalo hump is a hallmark manifestation of cortisol excess in Cushing syndrome. Question 11. A client with newly diagnosed Addison's disease asks the nurse why skin darkening occurs despite limited sun exposure. Which response by the nurse is most accurate? A. Elevated aldosterone directly stimulates melanin production. B. Excess insulin secretion causes pigmentation changes. C. Increased ACTH secretion stimulates melanocyte activity. D. Cortisol deposits pigment beneath the skin surface. Answer. C. Increased ACTH secretion stimulates melanocyte activity. Rationale. Primary adrenal insufficiency causes low cortisol levels, which trigger increased ACTH secretion from the pituitary. Elevated ACTH stimulates melanocytes, causing hyperpigmentation. Question 12. A client with Cushing syndrome is admitted with edema, hypertension, and hypokalemia. Which hormone imbalance is primarily responsible for these findings? A. Decreased cortisol secretion. B. Increased glucagon secretion. C. Excess corticosteroid activity causing sodium retention. D. Reduced catecholamine release. Answer. C. Excess corticosteroid activity causing sodium retention. Rationale. High cortisol levels exert mineralocorticoid effects, promoting sodium and water retention while increasing potassium excretion. Question 13. The nurse is planning care for a client with Addison's disease who reports chronic anorexia and weight loss. Which dietary recommendation is most appropriate? A. High-calorie diet with adequate sodium intake. B. Low-protein diet with fluid restriction. C. Potassium-rich diet with sodium restriction. D. Carbohydrate restriction to prevent hyperglycemia. Answer. A. High-calorie diet with adequate sodium intake. Rationale. Clients with Addison's disease often require increased sodium intake and sufficient calories to combat weight loss and volume depletion. Question 14. A client with untreated Cushing syndrome reports back pain and difficulty standing upright. Which complication should the nurse suspect? A. Osteoporosis resulting from protein catabolism. B. Acute spinal cord infection. C. Severe hypocalcemia-induced tetany. D. Hyperthyroid-related muscle spasm. Answer: A. Osteoporosis resulting from protein catabolism. Rationale: excess cortisol causes bone demineralization and muscle wasting, increasing fracture risk and musculoskeletal weakness. Question 15. The nurse is monitoring a client receiving 4-hydrocortisone for Addisonian crisis. Which assessment finding best indicates treatment effectiveness? A. Persistent hypotension and confusion. B. Blood pressure stabilization and improved mental status. C. Worsening hyperkalemia and tachycardia. D. Development of peripheral cyanosis. Answer: B. Blood pressure stabilization and improved mental status. Rationale: effective corticosteroid replacement improves vascular tone, electrolyte balance, and cerebral perfusion. Question 16. A nurse assesses a client suspected of having Cushing's syndrome. Which finding should the nurse identify as most specific to cortisol excess? A. Hyperpigmentation and salt craving. B. Central obesity with thin, fragile skin. C. Severe dehydration and hypotension. D. Diffuse bronzing of the extremities. Answer: B. Central obesity with thin, fragile skin. Rationale: Cushing's syndrome causes characteristic fat redistribution and skin fragility due to prolonged cortisol excess. Question 17. A client with Addison's disease asks why lifelong corticosteroid therapy is necessary. Which explanation should the nurse provide? A. Your adrenal glands are unable to produce adequate hormones. B. The pituitary gland permanently blocks glucose production. C. Your thyroid gland is suppressing adrenal function. D. The pancreas no longer regulates sodium balance. Answer: A. Your adrenal glands are unable to produce adequate hormones. Rationale: Addison's disease involves adrenal cortex destruction or dysfunction, resulting in insufficient cortisol and aldosterone production, requiring lifelong replacement. Question 18. A client receiving treatment for Cushing's syndrome develops fever and productive cough. Which nursing interpretation is most appropriate? A. The client is experiencing expected corticosteroid withdrawal symptoms. B. The client's immune suppression increases infection susceptibility. C. The findings indicate resolution of cortisol excess. D. The symptoms are caused by electrolyte depletion alone. Answer: B. The client's immune suppression increases infection susceptibility. Rationale: excess cortisol suppresses immune defenses, placing clients at increased risk for serious infections. Question 19. A nurse is caring for a postoperative client after transsphenoidal hypophysectomy for Cushing's disease. Which assessment finding requires immediate intervention? A. Mild sore throat and headache. B. Blood-tinged nasal drainage. C. Clear nasal drainage with positive glucose testing. D. Temporary fatigue and weakness. Answer: C. Clear nasal drainage with positive glucose testing. Rationale: clear drainage containing glucose suggests cerebrospinal fluid leakage, a serious postoperative complication requiring immediate intervention. Question 20. A client with Addison's disease becomes severely ill with influenza and cannot tolerate oral medications. Which instruction should the nurse reinforce? A. Skip corticosteroid doses until appetite improves. B. Increase physical activity to maintain adrenal stimulation. C. Seek immediate medical attention for parenteral steroid administration. D. Restrict fluids to prevent electrolyte imbalance. Answer: C. Seek immediate medical attention for parenteral steroid administration. Rationale: clients with adrenal insufficiency require stress-dose corticosteroids during illness. Inability to take oral medication increases risk for Addisonian crisis. Question 21. A nurse is assessing a client with suspected Addison's disease. Which combination of findings should the nurse anticipate identifying during the physical assessment? A. Hypertension, truncal obesity, and moon facies. B. Hypernatremia, hypokalemia, and fluid retention. C. Weight loss, hyperpigmentation, and hypotension. D. Peripheral edema, hyperglycemia, and buffalo hump. Answer: C. Weight loss, hyperpigmentation, and hypotension. Rationale: Addison's disease is characterized by cortisol and aldosterone deficiency, resulting in volume depletion, hypotension, weight loss, and increased ACTH-induced pigmentation. Question 22. A client with Cushing's syndrome reports progressive muscle weakness and inability to climb stairs. Which explanation best accounts for this manifestation? A. Excess aldosterone promotes muscle hypertrophy. B. Cortisol-induced protein breakdown causes muscle wasting. C. Elevated insulin secretion leads to nerve compression. D. Hypercalcemia increases neuromuscular fatigue. Answer. B. Cortisol-induced protein breakdown causes muscle wasting. Rationale. Excess cortisol accelerates protein catabolism, leading to muscle atrophy and proximal muscle weakness. Question 23. A nurse caring for a client with Addisonian crisis notes a serum potassium level of 6.4 milliequivalent/L. Which complication is the priority concern? A. Cardiac dysrhythmias. B. Increased intracranial pressure. C. Pulmonary edema. D. Metabolic alkalosis. Answer. A. Cardiac dysrhythmias. Rationale. Severe hyperkalemia can precipitate life-threatening cardiac conduction abnormalities and dysrhythmias. Question 24. The nurse is evaluating discharge teaching for a client with Cushing's syndrome. Which statement by the client indicates understanding of infection prevention strategies? A. I should report fever or signs of infection promptly. B. Minor infections are expected and usually harmless. C. I no longer need vaccinations because steroids protect me. D. Bruising means my immune system is improving. Answer. A. I should report fever or signs of infection promptly. Rationale. Clients with cortisol excess are immunosuppressed and must report early signs of infection immediately. Question 25. A client with Addison's disease experiences nausea, diaphoresis, and tremors before lunch. Which action should the nurse perform first? A. Administer insulin as prescribed. B. Check the client's blood glucose level. C. Restrict carbohydrate intake. D. Encourage ambulation after symptoms subside. Answer. B. Check the client's blood glucose level. Rationale. Cortisol deficiency predisposes clients to hypoglycemia. Symptoms suggest low blood glucose requiring immediate assessment. Question 26. A client with untreated Cushing's syndrome is admitted with blood pressure 182/98 mmHg point. Which mechanism contributes most to this finding? A. Excess cortisol increases vascular sensitivity to catecholamines. B. Aldosterone deficiency causes vasoconstriction. C. Chronic hypoglycemia stimulates sympathetic suppression. D. Reduced sodium retention decreases vascular resistance. Answer. A. Excess cortisol increases vascular sensitivity to catecholamines. Rationale. Cortisol excess enhances vasoconstrictive responsiveness and promotes sodium retention, leading to hypertension. Question 27. The nurse is caring for a client with Addison's disease who states, I feel exhausted all the time, even after resting. Which nursing response is most therapeutic? A. Fatigue usually disappears once you exercise more. B. Your hormone deficiency contributes to decreased energy levels. C. You should avoid sleeping during the day. D. This symptom is unrelated to adrenal dysfunction. Answer. B. Your hormone deficiency contributes to decreased energy levels. Rationale. Cortisol deficiency impairs metabolism and energy production, making profound fatigue a common manifestation. Question 28. A nurse is assessing a client with long-standing Cushing's syndrome. Which skin finding should the nurse expect? A. Thick and leathery skin with hyperkeratosis. B. Cool, moist skin with absent bruising. C. Thin, fragile skin with ecchymosis and purple striae. D. Generalized bronze pigmentation without bruising. Answer. C. Thin, fragile skin with ecchymosis and purple striae. Rationale. Protein catabolism weakens connective tissue and capillaries, producing thin skin, bruising, and abdominal striae. Question 29. A client with Addison's disease asks why stress increases the risk for adrenal crisis. Which explanation by the nurse is most accurate? A. Stress reduces glucose metabolism and eliminates cortisol needs. B. Your body cannot produce the additional cortisol required during stress. C. Stress permanently damages the adrenal medulla. D. The thyroid gland suppresses adrenal hormone release during illness. Answer. B. Your body cannot produce the additional cortisol required during stress. Rationale. During stress, healthy individuals increase cortisol production. Clients with Addison's disease cannot mount this response, increasing risk for crisis. Question 30. A nurse compares laboratory findings between clients with Addison's disease and Cushing syndrome. Which result is most consistent with Cushing syndrome? A. Hyponatremia and hyperkalemia. B. Hypoglycemia and dehydration. C. Hyperglycemia and leukocytosis. D. Low cortisol and elevated ACTH. Answer. C. Hyperglycemia and leukocytosis. Rationale. Excess cortisol increases blood glucose and can elevate white blood cell counts due to stress response effects. Question 31. A nurse is preparing a teaching plan for a client newly diagnosed with Addison's disease. Which instruction is most important for the nurse to include regarding medication management? A. Take corticosteroids only when symptoms become severe. B. Discontinue medications during periods of illness to avoid toxicity. C. Carry emergency steroid identification at all times. D. Double potassium intake while taking corticosteroids. Answer. C. Carry emergency steroid identification at all times. Rationale. Clients with adrenal insufficiency are at risk for life-threatening adrenal crisis and should carry medical identification and emergency steroid information. Question 32. A client with Cushing's syndrome develops sudden severe back pain after bending to pick up an object. Which complication should the nurse suspect first? A. Vertebral compression fracture. B. Acute renal colic. C. Lumbar muscle hypertrophy. D. Peripheral vascular occlusion. Answer. A. Vertebral compression fracture. Rationale. Excess cortisol causes osteoporosis and bone fragility, increasing risk for spontaneous fractures. Question 33. The nurse is monitoring a client admitted with Addisonian crisis. Which assessment finding requires immediate intervention? A. Blood pressure 76/38 mm of mercury. B. Heart rate 102 beats/min. C. Respiratory rate 22 breaths/min. D. Temperature 99.1 degrees Fahrenheit 37.3 degrees Celsius. Answer. A. Blood pressure 76/38 mm of mercury. Rationale. Severe hypotension indicates circulatory collapse and shock, which are life-threatening complications of adrenal crisis. Question 34. A client with Cushing syndrome is embarrassed by physical appearance changes and avoids social interaction. Which nursing diagnosis is most appropriate? A. Disturbed body image related to altered physical appearance. B. Impaired verbal communication related to endocrine dysfunction. C. Ineffective airway clearance related to cortisol excess. D. Risk for aspiration related to obesity. Answer. A. Disturbed body image related to altered physical appearance. Rationale. Characteristic physical changes such as moon face, truncal obesity, and striae commonly affect self-esteem and body image. Question 35. A nurse caring for a client with Addison's disease notes increasing weakness, abdominal pain, and confusion after gastrointestinal illness. Which laboratory result would the nurse expect? A. Sodium 124 milliequivalent/L and potassium 6.1 milliequivalent/L. B. Sodium 151 milliequivalent/L and potassium 2.8 milliequivalent/L. C. Glucose 280 milligrams per deciliter and calcium 11.2 milligrams per deciliter. D. Cortisol elevated above normal range. Answer. A. Sodium 124 milliequivalent/L and potassium 6.1 milliequivalent/L. Rationale. Adrenal insufficiency causes sodium loss, potassium retention, dehydration, and worsening electrolyte imbalance during illness. Question 36. A client with Cushing syndrome is prescribed a high-protein diet. Which rationale should the nurse provide for this dietary recommendation? A. Protein helps reduce cortisol secretion entirely. B. Increased protein intake helps counteract tissue breakdown. C. Protein restriction prevents sodium retention. D. High protein intake reverses adrenal gland enlargement. Answer. B. Increased protein intake helps counteract tissue breakdown. Rationale: cortisol excess causes significant protein catabolism and muscle wasting, making increased dietary protein beneficial. Question 37. The nurse is evaluating understanding of Addison's disease management. Which client statement indicates correct understanding? A. I should increase my corticosteroid dose during stressful events if prescribed. B. I can skip medication doses if my blood pressure is normal. C. A low-sodium diet will help prevent complications. D. I should avoid carrying emergency injectable steroids. Answer: A. I should increase my corticosteroid dose during stressful events if prescribed. Rationale: stress dose steroids are often necessary during illness, surgery, or major stress to prevent adrenal crisis. Question 38. A client with untreated Cushing's syndrome reports excessive thirst and frequent urination. Which complication should the nurse suspect? A. Diabetes mellitus secondary to cortisol excess. B. Severe diabetes insipidus from aldosterone deficiency. C. Acute renal failure caused by sodium loss. D. Hypoglycemia related to insulin hypersensitivity. Answer: A. Diabetes mellitus secondary to cortisol excess. Rationale: excess cortisol promotes hyperglycemia and insulin resistance, increasing risk for steroid-induced diabetes mellitus. Question 39. A nurse is assessing a client with Addison's disease for signs of fluid volume deficit. Which finding is most concerning? A. Dependent edema and crackles. B. Bounding peripheral pulses. C. Orthostatic hypotension and tachycardia. D. Jugular venous distension. Answer: C. Orthostatic hypotension and tachycardia. Rationale: loss of aldosterone causes sodium and water depletion, leading to hypovolemia and compensatory tachycardia. Question 40. A client with Cushing's syndrome asks why bruises appear easily after minor trauma. Which response by the nurse is most appropriate? A. Excess cortisol weakens capillaries and connective tissue. B. Your platelet count is always critically low in this condition. C. Bruising occurs because aldosterone destroys blood vessels. D. The bruising is unrelated to your endocrine disorder. Answer: A. Excess cortisol weakens capillaries and connective tissue. Rationale: protein breakdown from cortisol excess causes fragile skin and weakened capillary support structures, resulting in easy bruising. Question 41. A nurse is caring for a client with Addison's disease who reports craving salty foods daily. Which explanation best describes this symptom? A. Excess cortisol increases sodium excretion. B. Aldosterone deficiency leads to sodium loss. C. Hyperglycemia stimulates sodium depletion. D. Increased ACTH suppresses electrolyte absorption. Answer: B. Aldosterone deficiency leads to sodium loss. Rationale: Addison's disease causes inadequate aldosterone secretion, resulting in excessive sodium loss and salt craving. Question 42. A client with Cushing's syndrome is scheduled for adrenalectomy. Which preoperative nursing intervention is the priority? A. Limiting protein intake before surgery. B. Monitoring for signs of infection and hyperglycemia. C. Restricting fluids to prevent hypertension. D. Encouraging exposure to crowded environments. Answer: B. Monitoring for signs of infection and hyperglycemia. Rationale: clients with Cushing's syndrome are immunosuppressed and hyperglycemic, increasing risk for infection and delayed recovery. Question 43. The nurse is evaluating laboratory values for a client with Addisonian crisis. Which finding requires immediate reporting to the healthcare provider? A. Potassium 6.3 milliequivalent/L. B. Sodium 134 milliequivalent/L. C. Glucose 92 milligrams per deciliter. D. Calcium 9.0 milligrams per deciliter. Answer: A. Potassium 6.3 milliequivalent/L. Rationale: severe hyperkalemia can cause fatal cardiac dysrhythmias and requires urgent treatment. Question 44. A client with Cushing's syndrome develops severe hypertension and edema. Which nursing intervention is most appropriate? A. Encourage increased sodium intake. B. Monitor intake, output, and daily weight. C. Restrict protein-rich foods completely. D. Increase rapid for fluid administration. Answer. B. Monitor intake, output, and daily weight. Rationale. Fluid retention from cortisol excess can worsen hypertension and edema. Careful fluid monitoring is essential. Question 45. A nurse is teaching a client with Addison's disease about preventing adrenal crisis. Which statement indicates a need for further teaching? A. I should never stop corticosteroids abruptly. B. I may need additional steroids during illness. C. I can omit medication doses if I feel well. D. I should wear a medical alert bracelet. Answer. C. I can omit medication doses if I feel well. Rationale. Corticosteroid replacement is lifelong. Skipping doses can precipitate adrenal crisis. Question 46. A client with Cushing's syndrome reports increasing emotional instability and insomnia. Which explanation should the nurse provide? A. High cortisol levels can affect mood and sleep patterns. B. Your symptoms are unrelated to endocrine dysfunction. C. Aldosterone deficiency commonly causes hallucinations. D. The symptoms occur because of chronic hypoglycemia. Answer. A. High cortisol levels can affect mood and sleep patterns. Rationale. Excess cortisol can cause mood disturbances, anxiety, irritability, depression, and sleep disruption. Question 47. A nurse caring for a client with Addison's disease identifies which finding as evidence of effective therapy? A. Persistent hyperkalemia and dehydration. B. Improved blood pressure and energy level. C. Continued weight loss and nausea. D. Ongoing severe orthostatic hypotension. Answer. B. Improved blood pressure and energy level. Rationale. Adequate hormone replacement restores fluid balance, improves vascular tone, and increases energy levels. Question 48. A client with Cushing's syndrome is at increased risk for skin breakdown primarily because of which factor? A. Increased collagen synthesis. B. Severe peripheral vasodilation. C. Protein catabolism causing tissue fragility. D. Elevated calcium deposition in the skin. Answer. C. Protein catabolism causing tissue fragility. Rationale. Excess cortisol breaks down connective tissue proteins, leading to fragile skin and impaired healing. Question 49. The nurse is caring for a client with Addison's disease during a severe gastrointestinal infection. Which assessment finding most strongly suggests impending adrenal crisis? A. Blood pressure 84/46 mm Hg with confusion. B. Mild headache relieved with acetaminophen. C. Heart rate 88 beats/min with warm skin. D. Respiratory rate 18 breaths/min without distress. Answer. A. Blood pressure 84/46 mm Hg with confusion. Rationale. Hypotension and altered mental status indicate severe adrenal insufficiency progressing toward shock. Question 50. A nurse compares the pathophysiology of Addison's disease and Cushing's syndrome during endocrine rounds. Which statement accurately differentiates the disorders? A. Addison's disease results from cortisol excess, whereas Cushing's syndrome results from cortisol deficiency. B. Both disorders commonly produce severe hyperkalemia and hypotension. C. Addison's disease involves deficient adrenal hormones, whereas Cushing's syndrome involves excessive cortisol activity. D. Both disorders are primarily caused by pancreatic dysfunction. Answer. C. Addison's disease involves deficient adrenal hormones, whereas Cushing's syndrome involves excessive cortisol activity. Rationale. Addison's disease is characterized by adrenal insufficiency with low cortisol and aldosterone, while Cushing's syndrome results from prolonged cortisol excess. That wraps up our 50 NCLEX Addison's versus Cushing's Simplified Endocrine NCLEX review. Today you mastered Addison's disease versus Cushing's syndrome differences, cortisol deficiency versus cortisol excess, electrolyte patterns and lab interpretation, Addisonian crisis emergency priorities, steroid therapy safety, endocrine complications frequently tested on NCLEX, priority nursing interventions, and clinical judgment. Remember, Addison's equals low cortisol, low sodium, high potassium, LOW blood pressure. Cushing's equals high cortisol, high glucose, high blood pressure, central obesity. The NCLEX will test your ability to recognize these disorders quickly in clinical scenarios, especially during emergencies and prioritization questions. Keep practicing clinical reasoning, stay consistent with question training, and focus on understanding the why behind every answer. If this review helped you, continue sharpening your endocrine nursing skills with more high-level NCLEX case studies and critical care practice questions. See you in the next NCLEX session on MCQs Master 101.